I'm Mary Alice Citera from the State University of New York at New Paltz, and I'd like to talk to you about our paper, The Empirical Validation of the Horowitz Multiple Systemic Infectious Disease Syndrome Questionnaire for Suspected Lyme Disease, that I conducted with my colleagues Phyllis Freeman and Dr. Richard Horowitz. Lyme disease is a bacterial infection transmitted via bites of infected nymphal and adult female black-legged ticks. Lyme is the most common vector-borne illness in the United States and is rapidly spreading, not just in the US, but worldwide. It is already a significant health threat. The purpose of this study is to validate the Horowitz Multiple Systemic Infectious Disease Syndrome Questionnaire. Throughout this video, I will refer to the questionnaire as the HMQ. The HMQ has 4 sections. Section 1, the symptom checklist, contains 38 symptoms rated from 0, indicating none, to 3, extremely frequent symptoms. Example items include joint pain or swelling, confusion, difficulty thinking. Section 2, the Lyme Incidence Scale, contains items related to the likelihood of having Lyme and items about migratory symptoms. Section 3, the Healthy Days Scale, asks individuals about their overall health, physical and mental, over the last 30 days. Section 4, the Common Lyme Score, awards points for the most common Lyme symptoms. These include fatigue, forgetfulness, joint pain, tingling, numbness, burning, or stabbing, and disturbed sleep. We conducted 3 studies that demonstrate the value of the HMQ to alert physicians and patients to the likelihood of a Lyme disease diagnosis. Study 1 examined factor analysis and the psychometric properties of the questionnaire, reliability and construct validity, among individuals being treated for Lyme disease. Study 2 involved an online sample of participants who self-identified as either healthy or suffering from Lyme now. We examined convergent and discriminant validity. Study 3 compared HMQ scores for a sample of patients with verified Lyme disease with an online sample of healthy individuals. In this video abstract, we focus on studies 1 and 3. So the results for study 1 showed that the HMQ had acceptable levels of reliability. Using exploratory factor analysis, we found 6 factors. These include neuropathy, tingling, numbness, burning, or stabbing sensations, cognitive dysfunction, confusion, difficulty thinking, musculoskeletal pain, stiffness of the neck or back, fatigue, tiredness, dysautonomia, irritable bladder or bladder dysfunction, change in bowel function, constipation or diarrhea, and cardiorespiratory, sore throat, swollen glands. Now looking at study 3, we compared a sample of patients with verified Lyme. They either had an EM rash and or a positive Lyme test to a sample of healthy individuals. We conducted analysis of variance to see if the HMQ scores were predicted by Lyme status. We found that verified Lyme patients scored significantly higher on the HMQ than healthy individuals. Lyme status accounted for approximately 52% of the variance in HMQ scores. We found that the HMQ factor scores significantly differed by Lyme status. The results showed relatively low scores across all 6 factors for healthy individuals and substantially higher scores for verified Lyme patients. Overall, the discriminant analysis showed that we could accurately classify the Lyme status of individuals using their HMQ scores. Accuracy was 87.6%. We found that migratory pain symptoms were a key discriminating factor. These symptoms are a hallmark of Lyme disease. Using chi-square analysis, we showed that individuals with Lyme were significantly more likely to experience at least one symptom of migratory pain than healthy individuals. While the migratory pain symptoms are a hallmark of Lyme disease, they occasionally manifest in other illnesses. For our paper, Dr. Horowitz created a table that lists the differential diagnosis for migratory pain for each of these disorders, their clinical characteristics, and suggested laboratory testing. This table should aid practitioners in discriminating migratory pain symptoms of Lyme disease from other illnesses. To summarize, the results consistently demonstrated the convergent and discriminant validity of the HMQ. The HMQ accurately differentiated those with Lyme disease from healthy individuals. 3 migratory pain survey items robustly identified individuals with verified Lyme disease. The results support the use of the HMQ as a valid, efficient, and low-cost screening tool for medical practitioners and as an aid to individuals that may need to seek treatment. Thank you for your interest in our paper. I encourage you to download and read it for more detailed analysis and information.